more about diet and acne, about the foods you eat and acne. That's what we're going to talk about today. Welcome, I'm Dr. Arthur Kolsky, founder and medical director of Advanced Acne Institute, and we're an acne specialty dermatology practice. That's all we do. We treat acne all the time. That's all we do. So we have certain special insights and experiences that we have that we like to share with those who are trying to treat their acne or navigate the path toward a clear skin profile. So we hope that you can learn some information from what we talk about in these videos, but this is never meant to be medical advice. That is something that you need to seek out your own provider in order to be sure that your diagnosis and treatment is appropriate for your particular condition. In a previous video, I discussed diet and acne. I discussed how different foods can make you more prone to developing acne breakouts. But in this video, I'm going to refine that a little bit more, and I'm going to make that a little bit more relevant. So for example, if we're experiencing acne breakouts and we want to do everything we can to try and optimize our ability to get clear skin, well, it makes sense to also consider the role of foods in our treatment regimen. So it doesn't mean that just stopping certain foods is going to all of a sudden give you clear skin. It's typically not like that. So the role of diet and different foods that we choose in our diets doesn't usually turn acne off from on. It's not that powerful, but there is some evidence that certain foods do have a role. So typically we're talking about foods that have what we call a high glycemic index. So for example, foods that are processed and carbohydrates that are processed. And when you eat them, they release their carbohydrates, which sugar is a carbohydrate, into the bloodstream very quickly. So those kinds of foods tend to be the ones that the studies support as being more prone to causing acne to get worse. So we like to think about that when we're trying to do everything we can to optimize our treatment. So for example, let's say somebody has acne and they don't want to use a really aggressive treatment regimen. And some of the more aggressive treatments can have a really good result and lead to clear skin with a high probability. But let's say somebody doesn't really want to use one of those more aggressive treatments. So then it becomes more important to try to optimize all of the different aspects of our treatment. So we want to maybe use a really effective topical regimen, or maybe together with an oral regimen that has a chance of making us improved. But we also want to do things like lowering the stress level. We want to do things like not using things that can cause acne, like skincare products that are more acne prone. And we also want to optimize our diet. So even though diet alone might not be a really powerful thing to do to turn off acne, by using an optimal diet, an acne-safe diet, it might also help us toward our quest to using some less aggressive treatments, but yet getting clear skin. So in those contexts, diet can have a useful role. It might help us 20% or 30%, and it might be the thing that helps us to get just over the hump to get to a point where we're happy with our skin. So in that context, it is important to look at diet and to try to select foods that are not processed, foods that don't have a high glycemic index, which means they don't release their sugar content into the bloodstream more rapidly. We want to choose foods that are whole foods, foods that our body has to do the processing for, foods that do not contain that high likelihood of releasing a sugar load into our bloodstream right away. So that's just one more way to think about diet and acne, and use that technique to support any particular regimen of acne treatment that you might be undergoing to help you get to the point where you might have a good result and your acne might reach a level that makes you content and makes you happy.